at the histology in case you meet this diagram somewhere. Just in case you meet it somewhere. So we have a cross-section of the heart, and this cross-section has been made at the level of the valves, okay? At the level of the valves. So where are the atria here? If I say that this was cut at the level of the valves, already the valves that we talked about, and I'm sure we looked at all these valves. So if you look at, what valve is this one? With two cusps. The what? Eh? I said don't call it bicuspid, call it mitral. Aye. Yes, it's the bicuspid, but get used to calling it the mitral valve. Okay. Okay. So where are the atria? Anyone? Anyone? Where are the atria, guys? Okay, nobody knows. Why did we call these valves as the atrioventricular valves? Yes, sir. They are between the atria and the move. Okay? So what we are seeing here, through this, we can see the left ventricle. Through this valve, we can see the right ventricle. Are you oriented? Yes. And so, we have the cusps on the tricuspid valve. We have the anterior cusp, the posterior cusp, the septal cusp. This side, we have an anterior cusp and the posterior cusp. And then, here, we have the two vessels that are taking blood away from the heart. We have the pulmonary valve and we have the aortic valve. Is that clear? Remember, these two were called the semilunar valves. Is that clear? Yes. Now, why I brought out this diagram is the fact that at the level of the septum that separates the atria from the ventricles, we find the skeleton of the heart. The heart also has a skeleton onto which these chambers are anchored. Is that clear? And this skeleton is found at the level of the atrioventricular septum. And this skeleton is not made up of bones or cartilage. No, it is made up of fibrous, dense fibrous material. So what you are seeing here is that fibrous material that is forming the skeleton of the heart. And this skeleton of the heart, you come to appreciate it when we start talking about the conduction system of the heart. It is made in such a way that it does not allow impulses to traverse through it. Okay? When I say impulses, for now, let's take it that I'm sure you've done impulses, action potential in physiology, right? Oh, very good. So it does not allow impulses to cross from the atria to the ventricles directly through it. Is that clear? So all this part that has been labeled the left fibrous trigone is all about the skeleton of the heart. This side we've got the right fibrous skeleton, trigone of the heart. In case you meet that diagram, better seen here. Okay? That's our cardiac skeleton. The fibrous trigone. We've got the left and the right. Okay, guys? All right, so let's go and talk about the histology of the heart. This is a cross-section again of the heart. Not so cross-section, but the longitudinal section. Now, what we are going to be talking about is if we were to cut and get a piece from the walls of the heart, and then we magnify, we process that piece, and then we take that piece and view it under the microscope. What is it that we are going to find making up the walls of the heart? That's what we are looking at under histology of the walls of the heart. Is that clear? So remember that all the structures of the circulatory system were actually made up of how many layers? We call them the Tunica Intima, the Tunica Media, and the Tunica Adventitia. Except that when it comes to the heart, we are not going to call the Tunica Intima as the Tunica Intima, but we are going to call it the Endocardium, isn't it? And then it will be surrounded by the Myocardium, and then finally the Epicardium. Okay? So let's look at what makes up the endocardium. I think we start from the endocardium with the myocardium. Okay. So, the endocardium, as the name endo means inside. Is that clear? So the inner layer, which is the endocardium, is actually made up of one, the endothelium. Remember, all structures of the circulatory system are lined by the endothelium, the heart inclusive. So that endothelial layer is actually part of the endocardium. Surrounding the endothelium in the heart, we have a small, thin connective tissue layer, which we are going to call the subendocardial layer. Is that okay? Not subendocardial, sorry, subendothelial layer. So this layer of connective tissue, rich in collagen fibers as well as elastic fibers, surrounds the endocardium. And then, surrounding the endocardium, which we have seen being made up of two layers, the endothelium and the subendothelial layer. Is that clear? Yes. So surrounding the endocardium, or deep to the endocardium, we have the myocardium. The myocardium. Already from the name myo, what does that tell us? It's a layer that is made up of muscles. Is that clear? And these muscles, what type of muscles do we expect to find in the heart? Cardiac muscles. So we find that cardiac muscle cells are the ones that characterize the myocardium. But these cardiac muscle cells, they are nicely organized by connective tissue into endomysium and perimysium. Remember those terms? Yes. Yes. Okay. Now, the way these cardiac muscle cells are organized, I would want you at your own time to consult Google on images that will show the orientation of the cardiac muscle cells. Okay? And when you look at that diagram, you will be able to appreciate how the contractions help in the squeezing out of blood from one chamber to another chamber, and from some of the chambers to the great vessels. Okay? So already here, I have already mentioned that these muscle fibers, the bundles of muscle fibers, are arranged diagonally, okay, to each other, and you see that. Just get a diagram and see how they are oriented. That's when you're going to appreciate them. Remember that the myocardium, in the vessels It's not going to be called the myocardium, but it is going to be called the Tunica Media. Okay. Now, more superficial to the myocardium is the epicardium. The word epi means above, or superficial to a certain structure. Okay? So we are saying that the epicardium is the outermost layer of the three. The deepermost, or the deepest, will be the endocardium, which is closer to the lumen of the heart. Surrounding it will be the myocardium. And remember that when we talk about the myocardium, when we compare the right side of the heart and the left side of the heart, which one handles or pumps blood to a greater distance compared when you compare the right side of the heart and the left side of the heart? So the left side pumps blood, which must go as far as your toes, as far as your highest point of your scalp, okay? But the right side of the heart only pumps blood to the lungs. Therefore, which of the two chambers, the ventricles, is expected to have more cardiac muscle cells in its walls? The left ventricle. Okay, so the left ventricle, when you look at its walls, they are thicker compared to the walls of the right ventricle. All right. So when we talk about the epicardium is actually made up of loose connective tissue that is overlaid by the visceral pericardium. Remember the pericardium? The more reason why we needed to do the pericardium before we talk about the histology. Okay? So I'm now saying that. Sorry about that. Okay, so I was saying that this epicardium, in actual sense, which is the outermost layer, it is made up of loose connective tissue, just a thin layer of loose connective tissue, which is overlaid on the outer aspect by the visceral pericardium. Remember when we were talking about the pericardium, we divided the pericardium into fibrous pericardium and serous pericardium. Remember? Do you remember? And I'm sure you were tired by then, but you need to remember nevertheless. Okay? Then the serous pericardium was made up of how many things? What did we name them? What did we name the visceral. Two parts of the serous pericardium?
Visceral and parietal. Is it? Yeah.
You guys, you're not motivating me. I'm tired. That's why you're not even seeing me walking around. I'm tired, so you need to motivate me. Yes, sir. Then, what did we say makes up the serous pericardium? Nothing. Yes, ma'am. The visceral and parietal pericardium. Excellent. Okay. So, the visceral pericardium is a component of the epicardium. So you will find that where the epicardium is adherent to cardiac tissue, in those areas where we are going to find grooves, remember the grooves that we talked about on the surface of the heart, isn't it? So in the grooves, the epicardium is separated from the myocardium by blood vessels, and fat. In areas where there are no grooves, the epicardium is adherent to the myocardium. I hope you've gotten that. So when you look at a heart like this one, where is the heart?
On top.
Okay. So what did we call this groove again? What did we call this groove, guys? Yeah. All right. So we are saying that the epicardium is adherent to the myocardium in areas where there are no grooves or blood vessels. Okay? So in this area, the epicardium is attached to the myocardium. But in these areas where there are blood vessels and fat, the epicardium is on top. It's not in contact with the myocardium. That is the take-home message. Okay. All right. So that was the histology of the heart. We now talk about the conducting system of the heart. The heart is a structure or an organ that is ever contracting and relaxing, right? So for muscles to contract and relax, they need impulses, right? Yes. So we are also saying that even the heart also has a mechanism by which it receives some impulses for the muscles of the heart to be able to contract. So, where is the source of these impulses? In skeletal muscles, what was supplying those impulses? Hello? In skeletal muscles, what did we say was the source of the impulses? I expect a lot of hands from here because you are many. Okay? If I have a class of 100 students and a class of 1,000 students, the class of 1,000 students is supposed to have more hands when I ask a question compared to a class of 100 students. You are 100. You are humble. What? Who said humbleness? It tells not being able to answer questions. Okay, guys. So, anyone, quickly.
It's an innervation of a nerve guide.
Okay. So, the heart has an intrinsic mechanism of being able to generate impulses. Okay? It has an intrinsic mechanism of being able to generate impulses through special structures that are found within the heart, which comprise a system that we call the conducting system. Okay? So in other words, we are saying that the heart has special structures that comprise the conducting system, which is a system responsible for generation of impulses. Okay.
Go on view on
Remember,
high
when
quality.
we're
You see
looking at
better on high
muscle,
quality.
We say that for a muscle to contract, you need impulses. You need what? Energy in form of ATP. What else do you need for a muscle to contract? Calcium. Okay. So these cardiac muscle cells also need impulses. They need calcium. They need ATP. Is that clear? So the action potential or the impulses in the heart, they are generated by the conducting system. Unlike skeletal muscles, which will depend on nerves which are coming from the brain and the spinal cord for them to contract. Okay? For skeletal muscles, they are depending on impulses that are coming from the brain and the spinal cord through nerves which innervate those muscles or supply those muscles. But for the heart, it doesn't have to wait for the brain. It has its own intrinsic mechanism of generating impulses. However, these the conducting system is still regulated by the brain or the nervous system in terms of its generation of impulses. It's still regulated. Regulation in this case does not mean that it is the nervous system that generates impulses for the heart. No. The nervous system, through the autonomic nervous system, which comprises of the sympathetic and the parasympathetic systems, regulate or modulate the rate at which impulses are generated by the conducting system. Is that clear, guys? Okay, so let's now talk about this conducting system. So the conducting system of the heart is the one that has been indicated in this heart by these yellow structures, just the yellow structures, okay? So the conducting system of the heart comprises of, one, the sinoatrial node, okay, usually abbreviated as the SA node. It also comprises of the atrioventricular node. It also comprises of the atrioventricular bundle of His. It is also comprising of the Purkinje fibers. Okay, so I'm talking about the components. The sinoatrial node, the atrioventricular bundle of the, node, and then the atrioventricular bundle of His, which branches into these bundles or branches, which terminate into the Purkinje fibers. Okay, so those are the components of the conducting system. Now, of all those components that we've talked about, the sinoatrial node, which is considered as a pacemaker. I'm sure we've heard of the term pacemaker, isn't it? What can I say? Pace. Okay. The pacemaker, in other words, is the component of the conducting system that generates impulses. Okay? You are making noise. Oh. So this is the one, so the SA node is this one here, and it is the one that generates impulses. These others, the AV node, the AV bundle of His, the Purkinje fibers also have an ability to generate impulses. But the rate at which the AV node generates impulses compared to that of the SA node is that this one is slower. Is that clear? So because it is slower, so the one that sets the pace for generation of impulses is the SA node. So once the SA node generates impulses, those impulses will spread through the walls of the atrium. There's something we talked about cardiac muscle cells. We say that cardiac muscle cells act as a syncytium, isn't it? And what did we mean when we said syncytium? Anyone? the big class. Anyone, backbenchers? What do we mean when we say syncytium? I did explain what syncytium means. You are dancing with headsets in your ears and you are dancing. Can you leave this room? Can you leave? Can you leave? If you don't leave, I'll leave. Can you leave? You will be an example. Don't do it again, sit down. Don't you ever do that again. In class headsets. Only one Mutemwa. So, tell us what a syncytium means. You are still joking. Oh, can you tell us what a syncytium means? Quickly. Via what? Excellent. Thanks for your answer. So you should stop acting like that. Okay, so you get what she said. So because cardiac muscle cells act as a syncytium, once the action potential or the impulses or action potential has been generated by the SA node, it is able to spread through the muscle cells of the atria. So it's spreading through the muscle cells of the right atrium, also spreading across to the muscle cells of the left atrium. Okay? Because cardiac muscle cells act as a syncytium. Through those gap junctions, they are able to share ions. Is that clear? So that impulse eventually will end on, or they will end up on the atrioventricular node. So, last time I did talk about the location of the SA node. I actually told you to write it just on the sides, right? That's what you did, right? So we said that the SA node, this node, is located in the crista terminalis, isn't it? At the superior end of the crista terminalis, where the superior vena cava is joining with the walls of the heart. Is that clear? Yes. And we are now saying that in actual sense, the components of the conducting system of the heart are actually made up of cardiac muscle cells. Except that these cardiac muscle cells have a special function of not just contracting, but being able to generate impulses. So when you look at the cells of the conducting system and the cells of the rest of the walls of the cardiac muscles, cardiac walls, so you find that they are all cardiac muscle cells, except that the cardiac muscle cells that comprise of the structures of the conducting system have an additional role of being able to generate impulses. We are together? Yes. So, once the SA node generates the impulses spread through the walls of the atria. And eventually, they will reach, or some of those impulses will reach the atrioventricular node. Why are we calling it the atrioventricular node? Anybody? From what we've been singing about. Why are we calling it the atrioventricular node? Yes. How are you? Okay. Exactly. It is between the atria and the ventricles, isn't it? So in the flow of the right atrium, get me right, in the flow of the right atrium, and to be specific, the part of the flow of the right atrium that is closer to the septum, okay, the interatrial septum. So on the septal area of the flow of the right atrium, we find these special cells, okay, the AV node. AV simply means atrioventricular node. So this node, once it gets the impulses, it actually amplifies the impulses, and then it will ensure that those impulses are then transmitted out of that node into the atrioventricular bundle of His. This is the atrioventricular bundle of His. So the atrioventricular bundle of His passes through a little opening in the cardiac skeleton. Remember that there's a cardiac skeleton which is an insulator, which does not allow impulses to cross from the walls of the atria to the walls of the ventricles. So in between the atria and the ventricles was that cardiac skeleton. And I say that it does not allow passage of what? Impulses. So the only structure that can carry impulses to the ventricles is the atrioventricular bundle of His. We are together, guys. Where did those impulses come from? The SA node. From the SA node, the impulses spread through the walls of the atria, both the right and the left atrium. But if there was no insulator there, if there wasn't any skeleton there, those impulses were simply going to cross over to the ventricles. We are together? But because of that insulator, that cannot happen. There's only one route through which the impulses must travel, and that is through the AV bundle of His. This guy gets the impulses, amplifies them, and then passes them to the ventricles via the AV bundle of His. Now let's follow the AV bundle of His. You see that it is actually traversing through the septum between the two ventricles. And because the septum is between the two ventricles, we are calling it the interventricular septum. What structure on the surface of the heart indicated to us the location of the interventricular septum? Anybody?
The interventricular groove.
So if you missed my lecture on Sunday, hoping to catch up today, 0. So what structure or structures on the surface of the heart indicated to us the location of the interventricular septum? The guy in a checked shirt, green and white checked shirt. Yes, tell us. Ask your neighbor, hurry up. Guys, were you in my class on Sunday?
Yes.
I think I should give you a quiz, which should carry marks.
Yes.
Move on a quiz.
No.
Do you know how much I put in to try and simplify things? For your sake, for you to understand. And then you come and keep quiet. Yes, ma'am. The interventricular. Saukai, there are two. Thank you so much. There's an anterior one and
Posterior.
oh, guys, you are too many not to be answering questions. Okay. Anyway, yes. I said all the components of the conducting system are made up of cardiac muscle cells, but special cardiac muscle cells that have an ability to do what? To generate impulses and also to conduct impulses. Is that clear? Yeah. All right. So let's follow the bundle of His. So that's our bundle of His traversing through the interventricular septum. And look at what is happening here. The bundle of His is branching into these two bundle branches. There's a right bundle branch and the left bundle branch. Let us follow through the right bundle branch. There is our right bundle branch. Where is it going? Towards the apex, isn't it? Mm-hmm. And then from there it turns and starts to follow the muscles in the walls of the right ventricle towards the septum. Towards the atrioventricular septum. Have you seen? It's not cutting short like this. It's coming like that, goes to the tip, and then starts going upwards again. We are together? Yes. Let's look at what is happening to the left bundle branch. There's our left bundle branch. It's doing the same. And look at what is happening. What did we call this structure here? Onto which these are attached?
The papillary muscles.
A papillary muscle, isn't it? And because they are muscles, they need to contract, so they need innervation as well. And this has nicely showed us the source of their impulses. Is that clear? So exactly what is happening. So the end points of this conducting system that are now directly taking impulses to the heart walls or muscles, sorry. These are called the Purkinje fibers.
Okay.
So action potential is generated there, propelled in form of impulses to the walls of the atria. And once they receive the impulses, what do you think the muscles or muscle cells in the atria will do? They'll contract. Okay? As they are contracting, they are squeezing that blood into the ventricles, which are going to get the impulses later. Are you getting the point? So atria must contract earlier than the ventricles because they are receiving the impulses earlier than the ventricles. And that is just there to also enable squeezing or passage of blood from the atria to the ventricles. We are together? Yes. So that is the conductive system of the heart. So anatomically, there is no direct connection between the sinoatrial node and the atrioventricular node. Physiologically, they'll come and tell you about that connection. Anatomically, you don't see it. We are together? Yes. So let's look at the blood vessels. We are done with the heart. Oh, I was saying that the nervous system does regulate the conducting system. How does it regulate? So through the parasympathetic system of the autonomic nervous system of the nervous system. Okay. Yes. So the nerves that come to the heart, they carry parasympathetics and sympathetics. Clear, guys? So the parasympathetics and the sympathetics, their duty is to regulate the generation of impulses by the axon node. when the sympathetic system is activated, what it does is that it will cause the SA node to increase the rate at which impulses will be generated. So if there's an increase in the rate at which impulses are generated, it also means that there will be an increase in the rate at which the heart will be pumping. Isn't it? What happens when you suddenly find a dog which starts chasing you on the street? What happens to your heart? It starts pumping very fast. What happens when you see Dr. Mutemwa coming with Dr. Mukabe and Dr. Mdali for a viva? What happens to your heart? It starts pumping fast. So what happens is that your sympathetic system is activated during that time. And so what will happen to the SA node? It will be generating impulses at a faster rate. That's the fast pumping of the heart. The opposite is true for the parasympathetics. When you activate the parasympathetics, they actually dampen, meaning they slow the generation of action potential by the SA node. Therefore, your heart will start pumping slowly. We are together? So that's the only thing that the nervous system does on the heart. It doesn't generate impulses for the heart. The heart has its own intrinsic mechanism. Okay. The blood vessels. So when we talk about the structure of the blood vessels, I'm not going to go back. I showed you guys how blood flows from the heart to the ascending aorta, to the arc of the aorta, its branches, which are taking blood to the head and neck region. We had the subclavian artery, we had the common carotids, okay, taking blood to the head and neck region, isn't it? Okay. And then we saw that at the end of the arc of the aorta started doing what? Descending. Okay? The part of the descending aorta that was traversing the thorax, we called it the thoracic aorta. Then pierced the diaphragm, became the abdominal aorta, which then went on and bifurcated into the common iliacs, which bifurcated into the internal and the external iliac arteries, taking blood to the pelvic cavity and to the lower limbs. And then from the lower limbs, we saw veins, okay? The major vein being, for now, we had the external iliac vein, which was draining into the common iliac veins, which were draining or coming together, the left and the right iliac vein, common iliac veins, were draining or coming together to form the inferior vena cava. All the blood from the lower limbs and the abdomen and the pelvic cavities, they will eventually find itself in the heart via the inferior vena cava. All the blood that is coming from the head and neck region, from the upper limbs, eventually it will drain into the superior vena cava. So what we are now going to talk about is the structure of the veins and the arteries. Clear? And already we say that all the structures of the circulatory system comprise of those three layers. This is what we are talking about. The tunica intima, the tunica media, and the tunica adventitia. So let's see what makes up the tunica intima. So the tunica intima, starting from the luminal aspect, is made up of an endothelium. That's the first layer, okay, that lines blood vessels. An endothelium. Just beneath the endothelium, remember an endothelium is epithelial tissue, and epithelial tissue rests on the basement membrane. All right. So deep to the to the endothelium, you have the subendothelial layer. In some vessels, take note of that. In some vessels, surrounding the subendothelial layer will be the internal elastic lamina. Just from the name itself, internal elastic. What type of material do you expect to find in great amount?
Elastic fibers.
Elastic fibers, isn't it? Yes. So, in the tunica intima, you have the endothelium surrounded by the subendothelium. In some vessels, the subendothelium will be surrounded by the internal elastic lamina. Lamina means layer. Is that clear? There are a lot of people who are sleeping. I understand. Right. You're jumping high. All right. So let's move to the next layer, the tunica media. So the tunica media, remember it was similar to the myocardium in the heart, isn't it? So in the blood vessels, the tunica media comprises chiefly smooth muscles. In the heart, it wasn't the smooth muscle, but it was cardiac muscle. In the vessels, it is smooth muscles. Okay? Now, depending on the nature or the type of vessels you are talking about, mostly in arteries, these tunica media will have an additional rich supply of elastic fibers as well, alternating with smooth muscle cells. Okay. In some vessels surrounding the smooth muscles in the tunica media will be the external elastic lamina. Instead of you listening, you are busy typing. I don't know whether you're on WhatsApp or what. Right. They are not. Notes should be written by pen. Okay. So surrounding the tunica media, on the outermost or on the outer aspect of the walls of the vessels will be the Tunica Adventitia. So the Tunica Adventitia is made up of loose connective tissue, okay, which is rich in collagen fibers as well as elastic fibers. Okay, that's the Tunica Adventitia. Now, as we go on, you will see that not all vessels will have all the three layers. Yes, this is the general structure, but there will be differences, okay? So some vessels may only have maybe the tunica intima. Some will have the tunica intima and the tunica media. Some will have all the three layers. Okay? So having said so, let us look at arteries. But before I talk about arteries, I want us to look at what we've been talking about. I have two structures. I have an artery there, and I have a vein. An artery and a vein. All right, great, I'm sure. Can you see the Kesa?
No.
Can you see the Kesa now? Yes. All right. So, what we have now seen is the fact that those three general layers are further made up of smaller layers. So I have from here in this vessel, from this layer, or let me just start from the luminal aspect. From this layer of the endothelium to this layer, this is the tunica intima of this particular vessel. From here up to this layer here, this is the tunica media for this particular vessel. And then what remains here is the tunica adventitia. We are together? What about this vessel? This is a vein. And already we can see that in this vessel, the tunica media, tunica intima is only made up of this endothelium and the subendothelial layer. There's no internal elastic lamina. Already we can see differences, okay? What about the tunica media? For this vein, or generally for veins, the tunica media will not include the external elastic lamina. It will only have smooth muscle cells. And when you compare the thickness of the smooth muscle cells or the tunica media, this one is thinner than what we see in arteries. The tunica adventitia is the one that has been indicated in blue there. And already from here, you can see that there's a difference in terms of thickness between the tunica adventitia of veins and the tunica adventitia of arteries. We are together? And already just from here, before I leave this slide, you will realize that blood vessels, especially thick-walled blood vessels, they also have their own blood vessels that supply their walls. There's somebody who asked me last time when we were talking about the heart, to say, but why should the heart have its own blood supply? We saw that the walls of the heart, especially the ventricles, were thick and could not depend on what? Diffusion. Is that clear? So even these thick-walled vessels, they too have small arteries that supply them. And those vessels that supply and drain the walls of bigger vessels are known as the vasa vasorum. One is called the vasa vasorum. Several are called vasa vasora. So I'm sure, yes, you can see little blood vessels here, right? In the walls of a blood vessel. So these are the vasa vasora. Okay. Can you see the same also here? These are the vasa vasora. Okay. So let's now talk about arteries. When we talk about arteries, arteries can be classified. I did mention that arteries take blood away from the heart, but towards the tissues, right? That's what we say. So either supply and drain the walls of the blood vessels. Okay. Coronary arteries, there are coronary arteries and coronary veins. Right? Yeah, okay. All right, so based on function, yes, ma'am. According to the diagram that is there, right? Okay. It's because in actual sense, the other ones should have more vasa vasora. Why? Because they have thicker walls. Right? But nevertheless, even veins can have vasa vasora. Can have vasa vasora. Why they were shown to contain a lot of vasa vasora? It's because they have a thicker tunica adventitia where these are found. This one, have you seen how small, thin it is? That is why they've just shown a few. Okay. Yes. Now, what was I talking about? Yes. Function. So we are classifying arteries based on function. Here, we classify them as conducting arteries, distributing arteries, and the resistance arteries. In actual sense, the conducting arteries are the large arteries. They are conducting blood from the heart to different regions. Is that clear? The conducting arteries will branch off into distributing arteries, which in actual sense are the medium-sized arteries, which are distributing blood to different organs. Is that clear? And then in the organs, those distributing arteries will then branch off. They have missed. Busy laughing. Nothing. Ladies, I'm going to chase you. You are disturbing me. My eyes catch every naughty activity, and I'll be chasing you. Oh. Yeah. What was I talking about? You tell me what I was talking about. Tell me what I was talking about. If you don't tell me, just stand up and go. Okay, stand up and go. I've changed my mind. Stand up and go with your neighbor. Quickly. Yes. Remember, I just pardoned someone. I can't pardon you. You can go. Because I warned that one. That was a warning. I'll see you in the next lecture. Yes. Bye-bye. Those who don't have seats too can come and sit here. So as they are going, so the conducting, what was I talking about? Yes. So that in the organs, the distributing arteries will further branch off. Hurry up, ladies. They'll further branch off to give off small arteries. Remember when a hollow organ has a small lumen. When you compare the resistance in a small artery compared to that which we find in a larger artery, which one will offer more resistance?
The
smaller one. So because of the narrowness, because of the, if I were there, I was going to be very clever. I was just going to go and stand there. But it's okay. Since you're too many, I can't see you. Okay. You can call them and let them stand there. But don't miss what I'm talking about. It's either you tell them or you don't tell them. Okay. So the small arteries are resistance arteries. So those two want me to send them out. The resistance arteries. Okay. Then you can also classify these arteries based on the structural component. Okay. So the structural component, we are now saying that the large arteries, also known as the conducting arteries, are classified as the elastic arteries. Why do you want the aorta to be elastic? Anyone? It's a big class. I expect more hands. Yes, ma'am. Okay, let me give him a chance. There was someone there. Yes.
It's because it conducts blood at high pressure and
at high pressure, right? When the heart pumps, okay, and then this poor artery should, and then that wave goes, it recalls, isn't it? Yes, that is why these large arteries, the distributing arteries, should be elastic arteries. Is that clear? And then the elastic arteries will branch off into muscular arteries. What are you going to call them? Medium arteries. Or distributing arteries. Okay, which will further in the organs, they were going to divide into smaller arteries, which we called the resistance arteries, which we are now calling the arterioles. We are okay, guys? Yes. And this summarizes what I've been talking about. So let's talk about elastic arteries. Yes. What's your name? Cleopatra. Yes, Cleopatra. Oh, no, sweetheart. No electrical impulses. That was the conducting system. Hi. Now we are classifying arteries. Hi, baby. Yes. Yes. Wait, those are capilla. We haven't yet talked about the capillary. What are we talking about? Arteries. Hi, Ika. Hold your fire. We are coming. Okay, so let's move on. So, elastic arteries. Yes. Now you've woken up, guys. Yes. 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 Even those ones are called arteries. You know what? Where is that blood coming from? Where is it coming from? And being taken where? To tissues. The heart is a tip. Hi. Very good question. Okay. You others are still sleeping.
They call it organ tissue.
So elastic arteries. So the elastic arteries, examples of the elastic arteries, I already mentioned the aorta, the pulmonary arteries, the carotids, the vertebral, the subclavian, the common common iliacs. All those are elastic arteries. Is that clear? These elastic arteries, they also have how many layers? 3. The tunica intima, tunica media, and tunica adventitia. Let's look at their tunica intima. Their tunica intima is made up of the endothelium, the subendothelium, in addition, the internal elastic lamina. When you look at their tunica media will have smooth muscle cells which are alternating with elastic fibers. In addition, surrounding the smooth muscle cells, we have the external elastic lamina. We are together? So you think I'm not seeing you. Even if you cover your mouth, I see that you're talking. Okay, so take note. Elastic arteries will have internal and external elastic lamina. Is that clear? Yes. Then let's talk about the muscular arteries. We called them the distributing arteries. What else did we call them? The medium-sized arteries. Medium-sized arteries will have a tunica intima, which has an endothelium surrounded by the subendothelium. Is that clear? And then surrounding that will be the tunica medium. It will have a tunica, in the tunica intima, it will have an internal elastic lamina. But when we get to the, what do you call it again? The tunica media, Yes. So the tunica medium will have smooth muscles. It will have elastic fibers, quite all right. But when you look at the external elastic lamina, yes, it will be there. But in terms of thickness, it will differ with that which we saw in elastic fibers. Is that clear? Yes, it will be thinner. What about its tunica adventitia? It will have a tunica adventitia, quite all right, which has collagen fibers and elastic fibers. And in addition, you will find a lot of vasa vasora as well as nerves in the tunica adventitia of medium-sized arteries. Arterioles. When we talk about arterioles, remember that as we move away from large arteries, the lumen is getting smaller. What about the thickness of the walls? It's also reducing, isn't it? Therefore, arterioles will have a tunica intima, which has an endothelium and a thin subendothelial layer, but it will not have an internal elastic lamina. How about the tunica medium? The tunica medium will have smooth muscle cells, quite all right, and maybe a little bit of some elastic fibers. In terms of the external elastic lamina, it may or may not be present. Are you seeing that we are now seeing some differences, isn't it? How about the tunica adventitia? The tunica adventitia is extremely thin and may not even have the vasa vasora. Is that clear? Yes. So I have here part of the wall of the muscular artery. In this wall, can you see the cursor? Very good. Remember we talked about the tunica intima having an endothelium, isn't it? And that endothelium is made up of simple squamous epithelium. There's only one layer of flat cells. We cannot even appreciate the whole cell of the squamous cells, but we are only picking their nuclei. Can you see? How many layers? One. There's also that one there. It's been cut. Okay? So there's only one layer of these cells. Deep to them, can you see there's a space between that cell, that nucleus of that cell, and this pink stained line? Can you see? That space that is in between is the subendothelial layer. Did it answer? Deep to the subendothelial layer is this pretty pink stained layer. Nice, lacy in appearance. So that layer is the internal elastic lamina. And already you can see that because it's wavy, it is easy for stretching, for this vessel to stretch when pressure increases. Is that clear? Yes. And then this layer you are seeing now, this one, is the muscular layer or the tunica media. Have you seen? Then we've got the tunica adventitia. I have a nice, not so evident layer of some. Can you see this color? This one. These are elastic fibers. Okay. But in the tunica adventitia, I have a vasa vasora. One day you will develop eyes like mine. Hi. There's a vessel there, a vasa vasora. In the tunica Adventitia. I'm sure you can see that there's a difference from this level going upwards up to there, and the appearance of this tissue here, from here up to there. This is the Tunica Adventitia. Is that clear? Yes. Here on the arterial, I have a nice arterial. Okay? Then I have a nice venue there. Okay, I want you to look at the thickness of their walls. Can you see that there's a difference? This guy, the wall is thin. This guy, the wall is thick. So this is an arterial, that is a venue. Okay, we've got little venues there. Little venues, and the capillary, they are very small. It's as a result of branching of larger structures. These ones are arterioles. Okay, inside this arterial, you can see some red blood cells, these ones, and the white blood cell in the center there. Yeah, one day you will catch up with me. All right. So, we are now trying to follow through the flow of blood. So these will be the large arteries. These will be the medium-sized arteries. These will be the arterioles, which end up branching into capillaries. Is that clear? From capillaries, we now have venules, medium-sized veins, and then large veins back to the heart. This is the normal flow of blood. Is that clear? I'll get back to this diagram in a little moment. Okay, so I have an arterial there. We are at the level of the arterioles as they branch off to give off capillaries. Is that clear? So already from here, you can see that this arterial has an endothelium. Surrounding the endothelium are these smooth muscle cells. Okay? And only one layer. Already, meaning at the level where arterioles are giving rise to capillaries, even the thickness of their walls reduce further. So the larger arterioles may have the tunica intima and the tunica media, and even a thin tunica adventitia. But as they go down, as they branch off, becoming smaller and smaller, they will lose their tunica adventitia. Those smaller ones will lose their tunica media. Is that clear? Look at how thin the tunica media now is. Okay, these cells that are scattered. So after that, we are seeing that this arterial is branching off, giving rise to this capillary bed. At the beginning of the capillary bed, look at what is happening. There are some smooth muscle cells there. And also here, there are some smooth muscle cells. These smooth muscle cells are forming sphincters. A sphincter is something that guards an opening, which when it contracts, it will close off the lumen of that particular opening. So you find that the flow of blood into the capillaries from arterioles is not continuous because of these sphincters. At a certain point, the sphincters will open and allow blood to pass into the capillaries, and then they'll close to allow for exchange of materials to occur between the blood system and the tissues. After the exchange has occurred, these sphincters will open so that more blood comes in, and it will help push the blood that has already undergone exchange of materials. And that blood will flow into the venous component or system. Is that clear? There are certain instances and certain sites in the body where these can be closed for a while so that blood can just flow directly from the arterioles to the venules. We are going to call this as shunting. Is that clear? For example, when it is cold, your skin wants to conserve heat. We are together? How does it conserve heat? It will make sure that the arterioles in the skin are connected directly to the venules. Little should go to the capillaries because the capillary beds are closer to the surface. It is easy for them to lose heat to the environment. Are we together, guys? When it is hot, these will be active, making sure that blood is going to those capillaries so that heat is lost. Okay. In a normal setting, each arteriole should be followed by one capillary bed. This is the capillary bed or capillary network. And then that capillary bed must be drained by the veins. And that blood should go back to the heart. In special areas of our body, that may not happen. This is what may happen. I already explained the arteriovenous shunt type. In certain areas, you will have your arterioles branching off into a capillary bed, which is drained by a vein, which further goes to branch into a capillary bed, another capillary bed, which will then be drained by veins. Then that blood can go back to the heart. A system such as this one, which is characterized by two capillary beds or systems or networks, which are separated or connected by a vein. This vein, we're going to call it a portal vein. A portal vein is a vein that connects two capillary beds or systems. Is that clear? This type of a system is known as a portal system. Are we together? A portal system. Let's see where we can find this portal system. Here is our blood coming from the heart, isn't it? Through the aorta, that blood goes to the intestines. This capillary network is in the intestines. From the intestines, what happens in the intestines? Absorption of food, right? Once the food has been absorbed, that blood that is now rich in nutrients comes into a venous system, a portal vein, that takes that blood to another capillary bed which is found in the liver. So here we have the liver, here the intestines. Are you following me, guys? A capillary bed in the intestines, drained by the portal vein. We all know the hepatic portal vein, isn't it? Yes. Which, when it goes into the liver, what does it do? Branches off into another capillary network. And from that capillary network, that blood then goes into the venous system, into the inferior vena cava, back to the heart. So that is one site where we find a portal system. So define a portal system. That's what I want you to tell me. So system that is characterized by how many capillary beds? Two, which are connected by what? Portal vein. You also find this arrangement also in the hypothalamus, connecting it to the pituitary gland. Is that clear? Then I say, give me sites where we find the portal system. Z. I'm going to you guys. Okay. So, having talked about that, let's now talk about capillaries. Capillaries. So, capillaries, remember, they result from the branching of what? The arterioles, isn't it? So, and they are the sites where exchange of oxygen and nutrients occur. In where? In the tissues. We are together? So, let us classify capillaries. Capillaries can be classified into continuous, fenestrated, and discontinuous, also known as the sinusoids. We are together? Continuous. A capillary, mind you, will not have the Tunica Adventitia, Tunica Media. Why shouldn't it have all those? Because it's a site of exchange, meaning diffusion is occurring in the capillaries, isn't it? So we need a thin wall that can allow diffusion of these materials to happen. If these capillaries had Tunica intima, Tunica Medium, Tunica Adventitia with all those other layers, do you think it would be easy for diffusion to occur? No. So you don't expect to find Tunica Medium, Tunica Adventitia in the capillaries. And the same wall of the capillaries only has an endothelium with its basement membrane. And scattered on the outer surface of these capillaries, you may find special cells known as the pericytes. That information may not be there. The pericytes. These are contractile cells that when they contract will help push or squeeze blood in the capillaries to help that blood move in a certain direction. All right. So, having said that the capillaries are only made up of the endothelium with its basement membrane, we are going to differentiate these capillaries based on their structure of the endothelium and the basement membrane. Is that clear? So continuous capillaries have an intact endothelium and an intact basement membrane. Yeah? Yeah. What did I say? Intact and intact. Very good. And these are the common type of capillaries. They are the common type of capillaries. Is that clear? What about the other type, the fenestrated? The fenestrated capillaries have little openings in their endothelial cells. The endothelial cells are fenestrated. They have little pores through which materials pass. Is that clear? In which organs do we expect fenestrated capillaries to be in great numbers? We are talking about organs that are involved in filtration. Organs that are involved in what? So which organ is involved in filtration? Yes, so the kidneys have fenestrated capillaries. The choroid plexus in the brain, where blood is filtered to make cerebrospinal fluid, that choroid plexus have fenestrated capillaries. Which other capillaries do you want to have fenestrations? Where absorption of nutrients occur. So in the intestines, we find
Fenestrated.
fenestrated capillaries. So I say that their endothelial cells have little pores. Fenestration. but their basement membrane is intact. Let's now talk about discontinuous or sinusoids. Sinusoids, these are capillaries whose endothelium have large openings. Their basement membrane also have large openings. And because they have large openings, red blood cells are able to do what? To seep out. So tell me, what type of capillaries do we find in the spleen? The sinusoids. So they are not arteries, but they are what? Capillaries. Okay. So this is what is being talked about here. Look at that. Intact endothelial cells, intact basement membrane. Fenestrating capillaries. So here what you are seeing, these ones are vesicles which are transporting materials from one side of the endothelium to the other side of the endothelium. Right? Okay. This one, look at the endothelial cells. They have fenestrations, little pores. Look at their basement membranes, intact. This one, their endothelium has large openings, huge openings. Their basement membrane also is discontinuous. It has large openings. Clear? Venules from the capillary where exchange is happening. After exchange has occurred, this blood has to be drained out of the tissues. And then structures that are going to drain that blood from the capillaries are the small ends, which we call the venules. So the venules also, you've got the immediate venules that are draining the capillaries. We are calling them the post-capillary venules. What does the word post mean? Post means after. Is that clear? So these are venules that are just after the capillaries. And the post-capillary venules, their importance is that they are the site of a process called diapedesis. Diapedesis is simply the movement of white blood cells from the bloodstream into the spaces outside the blood vessels. What is the importance of the movement of those cells? Remember that these are immune cells. They help to fight infections, but they can't fight infections while they're in the blood vessels. They can't. Infections are usually outside the blood vessels, isn't it? So they literally, white blood cells should leave the bloodstream, go outside the bloodstream to go and carry out their immune or defense properties. Is that okay? So the actual leaving of the white blood cells from the bloodstream going to the outside is known as diapedesis. So the post-capillary venules are the sites of diapedesis. We are okay? I want you to go and read about the veins and look at the differences in the Tunica Intima, Tunica Medium, and Tunica Adventitia. But these veins are different from arteries in that, remember what was pushing blood through the arteries?
The pumping of the heart. Pressure. Pressure from the heart.
The pumping of the heart, right? But now look at the veins that are coming from the lower limbs. Where are they going? To the heart, which is up here, isn't it? What is helping the flow of blood through the veins against gravity? Especially, I'm talking about the ones that are coming from down there. So to help move blood in the veins, there are different things that contribute. One, veins have valves in them. If you go back to this diagram, have you seen that there's a difference here? This guy has these structures that look like what? Those semilunar valves, remember? Yes, these are valves. But here, in this artery, are you seeing any valves? No. The importance of these valves is to prevent backflow of blood. But to encourage unidirectional flow of blood towards the heart. Is that clear? Yes. And secondly, remember that these veins that are in the lower limbs, there's a lot of gravity acting on the blood that is flowing through them, isn't it? Yes. So these, they should have more valves. The veins of the lower limbs should have more valves compared to the upper veins. Are we getting the point? Because they have to counter more gravity. Okay. In addition, veins are usually, there are different types of veins. There are superficial veins and deep veins. For those that are deep, the deep veins, they are surrounded by muscles. Okay? So as you are doing different activities, for instance, we encourage you guys to walk when you are sick. We don't want you to continue lying down or sitting, isn't it? Why are we doing that? We want you, as your muscles are contracting when you are walking, their contraction is actually pushing onto the walls of the veins to help the blood in it to move in one direction, which is towards the heart. We are together? Yes. So you don't just sit. Encourage that sick person to move around. Otherwise, blood will pool in the extremities, and once it pools in these, what do you think will happen? The pressure will increase in the veins, and what will begin happening is that pressure will begin to push fluids out of the vessels, ending up with edema. And that in itself will also overwhelm your lymphatic system. Okay. The lymph vascular system. This one is just one slide. This very slide. Then we'll be done. Yes. Lymph vascular system. There's no whiteboard marker. Whiteboard in here again. Okay. So here I want you to follow me very, very well. We are in the tissues. I'm sure you can even see the cells of the tissues. Can you? Yes. And we are seeing that in between the cells is the interstitium. So these blue areas, this is the interstitium outside the cells, right? So when blood comes, we say that blood, as nutrients and oxygen are escaping the blood system, what else was escaping? Fluids, isn't it? So those fluids, when they go here, they must find their way back. And one of the ways we say, we have albumin, which does what? Attracts the fluids back into the vessels. But we say that not all the fluids do what? Get attracted. The other fluids, they are actually drained by these blind-ended vessels. We are calling them lymphatic capillaries. Yes, Mama. How about even explain? But ask.
No, it's on the veins.
Eh?
It's on the veins.
Uh-huh.
You explained saying the veins have got Epi Cardiac layer. Then for the arteries, it's got
Pina.
the
Manja ukambise na iwe. Talk like me.
Can you explain to say that the veins have got Epi Cardiac?
Tunica Adventitia.
Yes, then in the arteries it's actually small. What's larger in the arteries is
Muscular layer. The Tunica Media. Yes.
I wanted to know the reason why it's thicker in the veins.
Okay. Can anyone tell me, why do you think arteries have thicker walls? I'm now throwing it back.
Breathing pressure.
Yes, ma'am. Pressure. Thank you, ma'am.
What about for the veins, like in the outer? The veins, because the veins have got a thicker adventitia than the arteries. So I wanted to know the reason again.
Why it has thicker adventitia? You know, tunica adventitia is all loose connective tissue. So meaning, and this loose connective tissue is what is attaching the vessels to the structures surrounding it. So there is more of loose connective tissue in the substance of the wall of the veins, so that it can just attach it to structures that are surrounding the veins. But the other one, in as much as it has loose connective tissue in the tunica adventitia, it has a thicker media. You get my point? Yes. So it's not really that the tunica adventitia is doing much of the work. No, it's just passage of blood vessels and attaching the vessel to the structures that are surrounding it. Okay. Yeah. So what was I talking about? Yes. So we now have this lymphatic capillary. And look at the cells that are lining it, the green cells. These are endothelial cells. But these endothelial cells, they are laid in such a way that they are able to allow fluid to seep into the vessels. But that fluid, when it wants to move outwards, these same cells, the way they are arranged, they are forming a valve. It's like they collapse on each other to prevent the fluids from going backwards. Are you getting it, guys? It's easy for fluids to come in. The moment the fluids want to go out, they actually compress on this cell, which will close this. Okay? So, these lymph, and they are blind-ended tubules. Can you see? It's going nowhere. Here it's blinded. And then it starts getting big as it leads the fluid, which now is going to be called lymph. Once that fluid is in here, it becomes known as what? Lymph. These lymphatic vessels, as they go upwards, so we've got lymphatic vessels in the lower limbs, we've got lymphatic vessels everywhere except the brain. The brain doesn't have lymphatic vessels. Is that clear? Yes. So as these lymphatic vessels are going upwards, connecting to each other, they actually lead into lymph nodes. That lymph should pass through a lymph node. That's my point. Why is it so? Remember that lymph is coming from outside the vessels. Hi. Hello? Hello? It came from the vessels, then it went into the areas that are outside vessels. There can be, some areas can have infections. So to ensure that infections are not carried into the bloodstream as that fluid is going back to the bloodstream, that fluid must pass through the lymph node where that fluid is screened for infections. So if at all that fluid contains any infection, the lymph nodes will immediately react. And how do these lymph nodes react? They will increase the production of lymphocytes, which are going to fight that infection. Is that clear? So that by the time that fluid is leaving the lymph node, from the other end, that fluid is clean. Is that clear? Eventually, I say that all the lymph, where does it end up? Into the bloodstream. Is that fine? Now, generally speaking, can I have one gentleman? The one who's not writing. I can't keep calm. It's my queen's birthday. Come. which queen is this? Your mom? Oh, I thought it was the other one. When she comes, you will forget about your mom. Bad manners. Don't forget about your mom. So, let's move to the phone. Yes. So, eventually, there are two large lymphatic vessels where all the lymph must drain into. And those lymphatic vessels are the ones that are going to drain that lymph into the bloodstream. You don't say? So, I'm going to divide him. Follow me, because I don't have a whiteboard marker. There's nothing I can do. There's no whiteboard here. Aye. So I'm going to divide him here. Chua. Have you seen? When I reach here, the problem is that you think evil. So we are dividing the head and the neck into right and left, the thorax up to there. This is one region. Is that clear? The other region, all the lymph from the lower limbs, the abdomen, the pelvic cavity, the right side of the left side of the chest, left upper limb, left side of the head, left side of the neck, all that lymph ends up draining into the thoracic duct.
Okay.
All that lymph from the left side of the head, left side of the neck, left thorax, left upper limb, left all the abdomen. Remember, I divided him. I came here and ended here. So all this lymph will end up in a lymphatic vessel that we call the thoracic duct. This thoracic duct will go and drain that lymph at the point where the jugular vein, meets with the left subclavian vein to form the left brachiocephalic vein. So that is where the lymph in the thoracic duct drains. All the lymph that is coming from the right side of the head, right side of the neck, right thorax, right upper limb, it will drain into the right lymphatic duct, which is going to drain at the point where the right internal jugular vein meets with the right subclavian vein to form the left brachiocephalic vein. Thank you. So draw that in your books now. Draw him and divide him like I have said. Yes. Okay. At your own time, go and read about this. Okay. Any questions? Yes, sir. You wanted me to tell you about what?
How the speed is changing throughout.
Speed of what? Of light? Of blood. Okay. Though that you're supposed to find in physiology, okay? So, the flow of blood in the aorta, do you expect it to be the same as the flow of blood in the capillaries? Why, sir?
Capillaries are
They are thinner. Right? Do you expect the flow of blood, the speed of blood in the veins to be the same as that in the arteries? No. Right? So what are we seeing? The speed is doing what? It's reducing. Right. Yes. That is a summary in anatomy. The rest you are going to find it in physiology. Okay? Yes. Okay. Any questions? Yes, ma'am. Can you see what is happening here? This is depicting what is happening there. Where from the arterioles through this meta-arteriole, which is supposed to lead into the capillary bed. Remember there were sphincters here, so they close, and then blood will just flow directly into the venue. So we are shunting blood from the arteriole to the veins. That's the name, arterial venous shunt. This was just like a shortcut of writing it. Hey? Yes, ma'am. There were some 2 hands. Yes, sir. Yes. When I spoke of what? Yes. Yes. Damage to what? Parts of the? Oh, okay. What would happen if we were to damage, let's say, the hepatic portal vein? Let me just say, let's damage this one. In liver cirrhosis, those of you who drink too much, what do? You are causing scar tissue, okay? When the liver gets damaged, as it tries to heal, there will be a lot of scar tissue that is formed, which is constricting on the what? On the vessels, isn't it? So what do you think will happen? Will blood easily pass going this way? Hello? No. So what is going to happen? Blood will start flowing backwards, right? When it starts flowing backwards, is there going to be any change in the pressure in the blood that is going to flow? Remember, this side, blood is flowing this side. This side is blocked. It's now flowing backwards. What is going to happen to the pressure in the portal vein? It will increase. What we call portal hypertension, right? So blood is going to pool here. Remember I said that if blood pools, the pressures increase. What's going to happen?
Diffusion.
Fluids will start doing what? Leaking out. And once they leak out, they are leaking, the fluids is leaking into the peritoneal cavity. And what are we going to see? We're going to have ascites. Someone will be told to hospital, mulina manzi mumala. Eh? That manzi mumala is because of this. And also, there will be certain areas, you are going to learn about the portal systemic shunt as well. There are certain areas which are common to both the portal system and the systemic system. So as blood is flowing backwards, some of the areas where things go wrong is in the esophagus. So the vessels will dilate because blood is not flowing forwards, it's going backwards. So when they dilate, they can't hold the pressures. they end up rupturing and somebody will begin vomiting blood. Others, it is in the anal area. Again, in the anal area, there's an area of common drainage between the portal system and the systemic system. And what will happen? Somebody will start bleeding, hemorrhoids. Is that clear? Yes. All right, welcome. There was a hand high up there. Yes, ma'am. The lymph nodes. Excellent. That's what I was talking about. Okay? So, if you injure yourself, maybe on your foot, huh? What happens to your inguinal lymph node? You guys, you don't injure. We used to injure ourselves when we were growing because we used to play waida, game, blah, blah, blah. Okay? So, time and again, we used to have reactive lymph nodes in the inguinal regions. What do you call them in Bemba? Mtandamfula, right? But children of nowadays, they don't play. So they don't have mtandamfula. So what is happening is that where you injure yourself, infections go there, blah, 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 blah. You know, that place becomes something else, okay? Sometimes even pus is coming out from the area that is that has a wound, isn't it? And that area is being drained by lymphatic vessels. So as it is draining that infected area, the lymph will be containing what? Microorganisms, isn't it? So when those microorganisms go to the sentinel lymph nodes, which is now here in the inguinal area, the lymph nodes will immediately, because there are macrophages that are going to present those microorganisms to the lymphocytes in the lymph node. So immediately, the lymphocytes will know and see the type of microorganism that is, or that antigen, okay? And immediately, the lymphocytes, the B lymphocytes, will have to proliferate, the ones that will be identified as being specific to that microorganism or antigen. So they'll begin to proliferate. And as they proliferate, more cells are being made, isn't it? So those lymph nodes also do what? They need to increase in size. So it's not just the B lymphocytes that are increasing. By the way, the B lymphocytes, when they proliferate, increase in number to help fight that infection. They are going to release, the same B lymphocytes will mature into plasma cells, which are going to release antibodies that are also going to fight that infection. At the same time, T lymphocytes are also involved. They are also in the lymph nodes. That's our next topic, by the way, the immune. Okay, so you'll come and get it later. Right. So the proliferation will cause increase in the size of what? The lymph nodes, and the innervation. They are highly innervated. You are making noise. You are making noise. I'll consider the next lecture taught. You are playing with me. Yes. So they have the lymph nodes also have nerves, sensory nerves. So expansion of those lymph nodes will irritate the nerves and cause them to be painful. And inflammation is also going on in the lymph nodes as well because of those antigens. That's the pain. Okay. Yeah. The sound of the heartbeat. Okay. So the sound of the heartbeat comes from the closure of the valves. Remember, blood must flow once it's been received by the atria. It should flow into the what? The ventricles. So the valves open, right? So once the valves are, the ventricles are full, what happens to the valves? They must close, isn't it? So that as the heart is contracting, that blood does not go back to the atria. Is that clear? And during the time when the atrioventricular valves, both the right and the left, are closed, and it is the time when the heart is contracting. What do you think will happen to the aortic valve and the pulmonary valves? They should open to allow blood to do what? To flow into the pulmonary trunk and the aorta. Okay? Once that happens, the pulmonary valve and the aortic valve must close so that the atrioventricular valves can do what? Open. So the closure of the atrioventricular valves, they close almost at the same time. Okay? They will give rise to a sound that we call the S1 sound. Okay? Then the closure of the of the pulmonary and the aortic valves, they produce the S2 sound. That is why we end up having the lab-dub sound. Lab-dub, lab-dub, lab-dub. So the lab is by the closure of the mitral valve and the tricuspid valve. The dub is by closure of the pulmonary and the aortic valves. Thanks for reminding me. Okay. Yes. What's elephantalysis? Okay. So, elephantalysis. What happens in elephantalysis is that you have worms that are actually transmitted by a certain type of mosquito. Okay? So those worms, they go and clog the lymphatic vessels. Okay. So they go and clog the vessels. And once they clog the lymphatic vessels, lymph is not able to pass. Going to the thoracic duct, remember? Yes. So what will happen is that lymph, it's being produced the other side, isn't it? But it cannot pass to go to the thoracic duct. It's blocked somewhere. So what will happen? There will be accumulation of fluids. Is that okay? Yes. And that itself will give us elephantalysis. Okay? Cause is a difference. Yeah? And you will see that it's actually very bad because the lymph actually accumulates very much, and your limbs or one of the limbs will grow very, very big. Okay. Yes?
Is there a reason why the two lymphatic ducts, one takes up the smaller fraction of the body while the other takes up the
I'm not sure of the reason. Let me not tell you lies. Why? Maybe it's embryology, but I've never really read around the embryology of the lymphatic vessels. Yeah, I don't want to tell lies. All right. See you when you see me.